Kendia, ¿tú me vas a presentar o quieres que yo hable de mí?
Okay, we are live. Welcome everyone to our online conference from the International Conference of Medical Doctors and Project IMG. We are delighted to have you join us today for a unique and insightful session where Dr. Alan Bonder, a medical director at Beth Israel Medical Center from Harvard Medical School, will review the curriculum of our two giveaway winners, Doctors Adriana and Andres. During this conference, Dr. Bonder will share his expertise and provide valuable feedback on the CVs of our two doctors. Through this interactive session, you will gain valuable insights into the nuances of the CV development, specifically to the medical field. Dr. Bonder will highlight the essential components to include, offer tips for presenting your accomplishments effectively, and share strategies for tailoring your CV to different medical specialties and career goals. We encourage you to actively engage in this session by taking notes, reflecting on the feedback provided, and asking any pertinent questions you may have. Once again, we extend a warm welcome to all participants and express our gratitude for your participation in this enlightening conference. Let's welcome Dr. Alan Bonder.
Thank you, Kendia. It's a pleasure to be with everyone here today. I'm here very humble because I was like both Adriana and Andres a few years back, so I'm happy to help them and hopefully get them in the right track so they can be here in the next couple of years.
Hello, doctor. Thank you for the opportunity. We really appreciate it.
Thank you so much,
Doctor.
Dr. Bonder. We really appreciate this opportunity, and thank you so much to the organizers for giving us this event.
Yes, thank you, you too.
Yes, Doctor, thank you for giving your time to help us. And so we're gonna start first with ladies first, Adriana. She's gonna introduce herself and then we're gonna start reviewing her CV.
Thank you, Kendia. Well, I graduated from Universidad Mayor de San Simón in Cochabamba, Bolivia in 2021. During the last year, I have been preparing myself for step 1 and step 2. I am also volunteering at Tulane University School of Public Health. And yeah, what I want to do is pediatrics and a fellowship in genetics. I have been working with genetics and embryology during medical school. And I had the opportunity to do some externships in the area too. So I am very excited about working in the field.
Excellent, Adriana. So welcome to the United States, and hopefully we'll see you in residency soon. I want to add a few things. I think once you kind of, share me over your CV, there's a few kind of important things when you're applying to residency. And I'm going to discuss my experience in the internal medicine track because I did internal medicine and gastroenterology. But things that are very kind of important as you apply as a foreign medical graduate. So the first thing that we need to make sure is we are competing against every US graduate that's here in the country. And we need to be kind of shine. So we need to be kind of showing ourselves to be kind of, why are you picking you? So the first thing that I'm going to ask you, Adriana, is I need to know, how did you do in your medical school? So it's very important when you say graduating from Cochabamba, I need to understand, I need to know what were your grades, what was your kind of your rank within your medical school class, what did you do in your medicine, in the medical school to actually be outstanding. So you can be one of those specific students that could actually, we can just try to choose. So I think this is the first thing we look at CVs and residents. So can you please share me a little bit more about what have you done? What's in detail about your training?
Yes, of course. Well, I did very well during medical school. Like, we have actually, one of my questions will be like, what would be the good way to show that? Like, I mean, the only way that I could like kind of like the only like measurement probably was like at the end of the old medical school, we have been selected in groups to choose our hospitals according to our grades. So the first group with the best grades, they had to choose their hospitals during the first day. So I was called to choose my hospital during the first day to do my internship. But I don't know if that is like what would be the right way to show like what was the rank in my class in my CV. Actually, that is one of my questions. But I did well during medical school in general. I also applied to be a teaching assistant, and we also have to like take tests and be selected, because there is just one position to be a teaching assistant in embryology and genetics. So I got that position too during my last year of medical school.
So I would say, looking at your education, for example, in the US, it's well used, it's called a valedictorian. So for example, the top one in each class gets this degree. So we knew, for example, it's so important to say, I'm in the top 5%, I'm the top 10%. If you're the first, in your class, I would just mention, graduating from Universidad Mayor de San Simón in Cochabamba. And then I would use another sentence saying, hey, I was the valedictorian. I was first in the class with a GPA, which is your grades. GPA, I don't know, 10 is the higher grade, I'll say, with a grade of 9.6, and graduated with honors from this medical school. So I think we need to kind of make your degree, your medical degree, a little bit more important. So you, for example, if I see your CV over there with the education, this is very kind of simple. And you need to kind of, all the things that you just told me, it's very important to stress and send a message to the app, to the interviewers, that you are a person who, because of the really good grades and the high, GPA that you had, you were able to choose all the hospitals. So you, again, I think you have to make sure that you point that in your CV, and I just don't see it. So again, one of the main things here is when we are choosing residents from foreign medical, as a foreign medical grad, you need to be one of those outstanding foreign medical grads. And like here, I don't see that from your CV. So you need to kind of describe that a little bit in more detail.
Okay.
I don't know if that actually makes sense.
Yes, thank you. Okay, well, I think another thing that I would like to mention a little bit up is that I applied and I was selected to do externships, like student exchanges in different universities. So I did one. Wait a minute. Okay, well, I think I already talked about my assistant, like teaching assistant position. I did that for 1 year, and I was able to work with all the professors in embryology and genetics, because there was just one position. So the person who was selected needs to work with all the doctors in the department. I think that opportunity was very valuable for me, because I could learn from all like different techniques and methodologies from all the teachers. Like everyone has their own way to teach. So I really appreciate having that experience too. I also organized the first embryology and genetics Olympics, and it was the first time that we implemented technology. It was an online, it was an in-person activity, but all the students did that through their phones. So I tried to implement a lot of new online and interactive activities with my students when I was working with them. And I think that was very useful too, because just 1 year after the pandemic hit, and I feel glad that they already knew how to like kind of approach technology and take tests and do quizzes and games related with medical field and technology. When I was a medical student, I also joined the Scientific Society, and especially the International Federation of Medical Students Association. I think that was one of my valuable experience during medical school. I think I thought it was really important what I will learn with the academic preparation, but also I would like to have an extra learning and be able to work with the community too, be able to work with international students too, to share experiences about how we manage different situations in different countries, so we can help each other and we can like try to apply the same approachments in our countries. So I work first in my university as a subdirector of Medical Exchanges Committee, and then I applied for the national position. And I work in the national position for 1 year, and I had the chance to represent my country in 2 meetings, one in Peru, and the other one that was the General Assembly with students from all the country, that was in Montenegro. So I was representing my country in that meeting too.
So let me stop you there for a second, Adriana. And, the first thing is like, a few things from about your CV is when you're not a fully graduated medical doctor, it's important not to put in there as assistant professor. So you will always be like a teaching assistant. So those things kind of confuse people in the US, because assistant professor in the US, it's a degree that you actually gain after you being in the area for quite some time. So I would just remove that from your CV. I think the leadership positions are very important, so you can actually just emphasize them, the importance, and again, this goes all well with your, I would just be kind of a little more descriptive. It's like, why were you chosen as a National Officer Medical Exchange Program? So you can say, National Officer Medical Program, and I will describe a little bit more with 2 sentences, say, this position was offered to top 3 students in the medical school. This, this was, I don't know, you can say this was some type of competition within the medical school students, and then whoever, made this hired, someone who had the higher kind of test results was able to get it. And same about the subdirector of medical exchange program. So those leadership positions, you're building up to them. So actually we'll just describe, instead of just putting a date and the position, I would actually describe them. How did you get them? And then what does it mean for you to have them? And again, as far as after that, then I will actually go a little bit in the honors and the awards. Again, when you're talking about an award, I want you to talk about it and then describe what's the award. For example, you're saying the finalist, here's a finalist award International Diagnostic Championship. So what does that mean? Who goes into that, championship? So how many people were there? You won something. All those things need to be in detail. So then again, just kind of pointing that you are a star, you're a rising star. You want to make sure that you show them that you are one of those people who will basically succeed if you come into the US. So I would just, use a little bit more sentences in all those leadership positions and Arnie awards to describe them more in detail.
Okay, thank you so much. Okay, so after I graduate, I also work as a tutor. So I have been like doing lectures to medical students, like first-year medical students, about embryology development and fetal development. And I did about 10 sessions of each area too. Should I describe more about this experience too?
I would just do it, if you actually go up, Adriana, a little bit more in your CV, as this is part of the same as your teaching assistant part, teaching assistant programs, because you actually have academic appointments. Is that something that will be the same thing? So I will not mention this because, again, I'm sure this is the same medical school because of the years that you're putting in there. So I would use exactly the same, kind of put all those two educational activities and use them and pull them up there where you have all the kind of academic appointments.
Okay. So about my research experience, I joined as a volunteer Tulane School of Public Health, and I'm still working as a volunteer in that department, in epidemiology department, in a research study focused in children with asthma. So I'm helping them basically with recruitment activities and also follow up the participants, doing pre-screen and screen interviews.
So I wanted just to take just a second again here, and I want to stress the importance of research experience to apply to any residency in the US. So everyone knows that residency in the US is very competitive, and you need to build up a CV. And when you're building up research experience, again, you have to tell me the full story at the end. So I see you run Tulane. What were you doing? So you say recruitment and follow-up patients. So I will be more descriptive of what were you doing there. Give me a 2-3 line sentence. So I'm in charge of 3 research protocols, who are, dedicated to asthma in kids of low income, for example. And I would say, what's your role? So I'm just a patient recruiter. I'm a data entry person. What's your role in that research group? And again, when you say research education, I will just take that away and you will put everything, you will describe everything. And again, what's your goal as a researcher? So you can say, when I actually look at CVs, I'm looking at this, you're really telling me a story, right? For example, you want to be a pediatrician who specializes in genetics. So your research needs to build up to that story. So how you actually started doing things when you were younger in your medical school, how you basically came in here to do research, and then you are trying to take this to when you graduate and when you be a full pediatrician to be a full geneticist. So this is actually the story that needs to make sure that you match in your CV. And this is the things that you need to make sure that you put it in order. So right now, as you told me, I was a TA in embryology, which is great. And then you are continuing your story to try to be that person. And now you join a research group. I want to make sure that you tell me in detail what those research group details are. How is that going to help you to be the person that you want to be in the future? And again, that's exactly what I would just comment in your CV. And finally, the research education, CT program, biomedical research investigators, and key personnel, I don't think is really important to put in your CV. It is more important to tell me, the amount of research protocols that you actually enrolling patients. You might be saying it's like, this 3 research studies will be something that will actually come into a paper. So maybe working on abstracts for future meetings, all that stuff need to be in your research part of your CV. And again, it's one of the most important places of your CV applying to residency because they want to know that you are productive. So you spend extra time doing voluntary work or research stuff, then you have to show the program directors that you are being productive from that perspective. So I don't think that makes sense. But again, you have ways to go here in the research part of the CV. And I think you need to make sure that you, again, think about you are telling a story and how you're going to match the story with whatever you want to do as your future career.
Okay, I understand. I understand that. Okay, can we go a little bit up? That I have a question.
Yes.
It was up. More up. I think we passed that part. Okay, yeah, this about my medical training. So I did exchanges during medical school. So I did an extra rotation, an externship in pediatrics. And so I did one in Colombia. And then I did one externship in genetics in France.
Okay.
and then one in internal medicine during my internship in Buenos Aires.
So they're okay to put it in there in your medical part of training, but this is all part of your, I don't know. So again, where I'm from, you get a fifth year where you can actually get all those different externalships or rotations. So if you want to just, for example, if you want to, if someone is giving you a letter who is the person from the genetics internship in the hospital in France, then I will list it as like, I went to France, visit this famous geneticist. I was able to spend some research with them, and then at the end, when you're actually getting your letters, then that's something that I will actually list as your letter, because again, this is a full story. When you look at this part of your CV, I don't think it's actually that necessary to really go into detail that you went to Buenos Aires, and you went to pediatrics in Colombia, unless you're telling me there were specific parts of those rotations that really made you think that genetics or embryology or pediatrics were the kind of like the important things that converted you to be a pediatrician. Does that make sense?
Yes, absolutely. And if there was like competition to get these externships, because we have to apply and compete with all the students in the country to get these externships, should I describe that too, or it's not necessary?
Yes, I will describe them that, for example, if your externship in France was only given to the first 3 GPAs of the class, then I would just say, listen, I was one of those really, really good kind of GPAs. This is why I was able to go to that place. But if there's nothing like that, then I wouldn't mention it. It's not important.
Okay. Thank you.
But I just really want to make sure that we pay a lot of attention to the research experience and the research education, because it's just like one of the key things is like, a couple of things when we're looking at applications. Remember, there's a lot of filters. How we're going to look at your CV as an outstanding CV. I want to make sure that the CV, the research part, shows like a really, really important thing. So, mention all the protocols that you're on, mention your role in there, and then, for example, you can think about is like, in the research is, this might lead to, for example, want to get a master's degree in public health because I think it's necessary. So all those things need to tie it up into a story. And what I'm trying to see is I want to make sure that the story goes from the beginning to the end. And I don't see a kind of a linear story. It's all over the place.
Okay. Okay, so here in the external education, I just choose some activities. I used to attend to different conferences when I was in medical school, but I didn't know if it was necessary to mention all of them. I just mentioned the last ones, the ones that the 2 most important ones that are the ones that I mentioned representing the country, and 2 or 3 events that I participated here in the US. So should I mention more external education activities, or that's okay with the last ones or the most important ones? How should I choose them?
I mean, unless you're telling me that you presented something in those meetings, I don't think you should spend a lot of things in there. Unless you, for example, you're an organizer, or this was, for example, you had the idea to develop, I don't know, one of those genetics from Bolivia conferences. I don't think they're very important in your CV, and I don't think they're actually something that matters. So, for example, taking away the IMG event, the MOLA conference, all those things are really not key, and there's nothing that it's going to show in your CV is going to make a difference.
Okay, thank you. Well, in education in public and community education, so I mentioned some of the activities that we do more related to give talks to the community. Well, in the first activities, I'm also volunteering at STEM NOLA. That is an organization that gives or provides STEM activities to kids with low income resources. And they are all free. They are related in different areas. So I participated in the cardiovascular system activity. Then all the rest of the activities are like I did all of them in Bolivia, and I did through the International Federation of Medical Students Association. We used to have like monthly activities with the community. So I just mentioned some of them too. I didn't mention all of them.
So again, this is kind of important work for example, the specialty you want to do. For example, treating underserved communities, specifically in pediatrics, is very important. So I will go in detail about what exactly did you do. For example, you're saying the Teddy Bear Hospital in Cochabamba. So what was your role there? Was your role to be, an educator for, I don't know, early vaccination, or was your role going to be to enroll people in primary prevention? So all those things need to be kind of in detail. But again, Adriana, you want to apply to pediatrics. So think about what are the things that pediatrics makes the most sense. For example, pandemic repercussions, that's something that is really important for pediatrics. TB and patients for pediatrics, those things make difference. And I would actually spend a little bit more time in a couple, 3 to 4 lines in there, explaining what was your role, what did you do, and how that make a difference in, I don't know, in Bolivia, or how do you think that make a difference? So that can be something important in your CV.
Okay. Okay, well, in educational development, curriculum and educational materials, so I updated our genetics textbooks and when I was a teaching assistant. And yeah, the other thing I mentioned was the first genetic and embryology Olympics and all the interactive and online resources that I created for the student during my teaching assistantship. So I should describe in detail those activities too, right?
Was there any publications out of this? So you say that you were able to modify. Was there any educational materials that were able to publish out of this? So then I would just mention that and describe exactly, why was there so important?
Okay, but with the publication, like we need like an official publisher of the book, right? Because I updated the book, but I write down.
You did enough work to publish, right, Adriana? So I would just say that you work on the publication, you were in the, I don't know, in the editorial committee of the new curriculum, all that stuff. And I will mention exactly what are the topics that you edit. So be a little more in detail about what did you do over there.
Okay. But if the book was like just distributed to the students, like I should put that just if we have like an official publisher of the book.
No, we don't. I don't need an official publisher, but you need to just show them that you've done some work in teaching, and that actually shows that,
Okay. Well, then in volunteering activities, STEAM NOLA, which is the organization that I mentioned before, Tulane School of Public Health, where I'm doing research. During the pandemic, I worked for 6 months in the call center, COVID-19, like doing telehealth and receiving all the calls, referring the patients to ambulance, to centers, giving diagnosis, treatment, prevention to the patients, and explaining them about ways that they can be safe and protect their families, and doing the follow-up with the patients. All the patients that we receive, we treat them and follow up them until they were completely asymptomatic again.
But again, Adriana, all that stuff is not, you're telling me, but think about it. No one, when you send that your CV to someone, how do they know that you did it? So again, just make sure that you describe exactly what you're doing with those things. Again, you don't have to write an entire paragraph, but 2-3 lines saying I was in charge of telehealth and people were diagnosed with COVID, and I would follow them, after the diagnosis to make sure they're okay, and then with prevention within the families. Something like that. So you showed people that you were involved in all these projects.
So about the scholarship, should I put it again or should I just not put it? Because
I mean,
We
you know,
got-
you already describe it in your teaching part of it, so I would just leave the scholarship unless they are, so are they paying you any money to be a tutor, then I would just use it as like, you know, maybe top 5 GPAs will actually have some type of fees or some type of stipend that, you know, help teaching all the other medical students.
Yeah, we got the stipend if we got
Yeah.
the position. So about the memberships and activities, like if I don't have a specific position, should I just not put it there?
Yes, I would take that off. I mean, unless you're a member of a society of like a, then I would say there is, I mean, at your stage, I think they're not important and I would not spend any time in there.
Okay.
And then something about besides languages is, do you have any kind of what's your hobbies or something, you know, is anything interesting besides you being a doctor, you know, what's cool about Adriana, you know? Remember, on top of being doctors, we not be like normal human beings. So also people choose people who like have really good hobbies. So just basically just give me one or two, you know, things, you know, saying, hey, I'm a runner. I've had people saying, you know, I play karate for the national team in Argentina, and, you know, cool things that actually makes an impact when you're looking at CVs.
Okay, I'm gonna add the hobbies. I didn't think about putting anything about related about the things that are non-academic, which I think it's important to. Okay. So about the professional development, I've mentioned some like online courses that I have been doing in the last year. I don't know how important would be that to mention, or should I just not put it there?
I don't think they're that important. I would just take them off. Again, at your stage of career, you know, that they're not important. So I would just basically, unless you are presenting things, unless you are showing things, or you're part of the organizing committee of any of those conferences, I don't think they're important to list.
Okay. Yeah, and then the last part is languages. So the hobbies, should I add them like at any specific, is the format something that really matters? Like which things should I put first? Should I put the hobbies in any specific part of the CV?
So if I ask, so then I think about it, I'm dropping your CV in someone's desk, and I want to see something really cool that Adriana does that's not in the medical world. What would that be? So what would be that description? So I'm giving you examples. So I've seen people who are national champs of karate in their countries. I've seen people who basically, you know, they've run 3 Ironmans in the last 3 years because they think that's a really cool thing. So all those things are kind of key because we want to know, and program directors want to know that besides being a really good physician, have awesome grades, doing a lot of research, you're really kind of a normal human being. You're able to kind of have relationships with other kind of your peers. So that's really, really important to put there. So again, whatever you think it's actually, again, sending the message of, well, who is Adriana besides in the medical world, that's something really important to put in your CV.
Okay, thank you so much.
Great, doctor. Thank you, Adriana. Do you have more questions for the doctor? Do you have any more questions, Adriana, for Dr. Bonder?
I think those are all my questions. Thank you so much. It really clarifies me a lot.
Definitely. Great tips.
Dr.
All right.
Bonder.
Continue with Andres.
Hello, Candia.
Going to present himself.
Well, hello, guys. Oh, sorry, Candia. Well, my name is Andres. I'm a medical doctor here in Mendoza, Argentina. I graduated last year in May. I took my step 1 exam in March and I passed, so I'm really happy. Now I'm preparing for a step 2 exam. Well, I'm working. I work in a clinic here in Mendoza called Santa Maria Clinic. where I am the medical ward, and I always work on weekends with the Liga Mendocina de Football. That is, there are soccer matches, and I am the medical doctor if any injuries or something happen in the field. About my medical school, I entered in 2016, and I graduated from Universidad Nacional de Cuyo. It's a really hard med school to enter because you have to take an exam that is really, really hard. I remember we were 2,000 applicants and only 95 passed the exam. I remember that we were in the newspaper because it looks like really difficult. But I think that is because we have very few universities, so everybody wants to study medicine here. Well, that's why the exam is really hard. And the next years, I start to do some kind of research, and I always love to do like Adriana, a teacher's assistant, and because I always did ad honorem works, and because I always was my objective was to teach, and I knew that if you teach good, it's because you learn too. I was in anatomy school because I really love it. I think it was really important for me because I want to be a surgeon if it's not an internal medicine doctor. I think that another thing that I could do in my university, I was a dissector. I don't know if there is the right word, doctor. So we were with the bodies and we could dissect them and we prepared them for the students, and I really enjoyed that activity. I have done, I think one of my skills that like my CV says, I am a really teamwork. I really am persevering. I love TICMD with the doctors. I always take the opportunity to learn something new. I'm open to opportunities. I'm not close because I love a lot of subjects that in medicine, and I think that I have done it all around my formation here in my university, and I really love it, and I really appreciate that. I want to be now. I'm preparing for the exam because I want to be a resident like Adriana in the United States in the next few years, and I think that all that I did in my university could help to strong my CV, like Dr. Adam was saying to Adriana. Well, I think that I am enjoying the path, and I don't know, just keep going.
So let me stop you there for a second, Andre. So in your CV,
Yes, doctor.
go up for a second, it says in education. Why do you have two medical schools listed over there?
Sorry, Doc, what two medical schools?
It says education, it says MD,
Medicine?
it says MD, Universidad Nacional de Cuyo, and then if you go
Yes.
down, there's something about Chile.
Yes, because after I graduated, I did my homologation in Chile,
So what does that mean?
that I can work as a medical doctor there.
Okay. So did you have to take any tests or anything like that for that?
Yes, you have to take what is called ICANN exam.
Okay. So
Yes.
I think your CV is pretty kind of like, I haven't seen this distribution. It's actually pretty cool, to be honest with you. It actually shows a little bit, but in the education part is like, you need to tell me why there's two medical schools there, and then that can send two different messages, and you want to make sure that you send the right one. And the right one is, got my degree from MD, got my MD degree from Universidad de Cuyo, but I was able to have 3 months or 4 months, and I was actually able to validate a full MD license in Chile based on this test.
Perfect.
I would take that as an education way. and I would put in a different kind of part of the CV.
Okay. Okay. Perfect.
Because, you're saying that you were in 2 medical schools within 6
Yeah, it's
months.
kind of-
That shows a different message. Then you put in an education, your step 1. I would take that away. You don't have to list your step 1. So your step 1 can go into testing or anything else, but for both, I think Adriana did not list her step 1 scores, and I don't think you guys should list it because that's
Okay.
not important for your CV. So I will take that off.
Perfect.
And then you put in your professional summary. It says, ready for new goals, willing to investigate in the US to be a better professional, enrich my knowledge in medicine. That sounds really good, but it's not part of your CV, right? This is not what you've done. This is exactly what you want to do. So I will take off that also part of your professional summary.
Okay.
Then in your skills, that they're good skills, but again, I would list it, made example, maybe at the end, what are your specific skills about teaching techniques? Maybe you are, a tech savvy person and you know how to use, I don't know, I'm making this up, Excel and PowerPoint to a different world, or you are someone who was able to use statistics software. So those things, skills should not be listed, like, for example, health assessment, differential diagnosis. That's not something that you want to put in your skills.
Perfect. Okay. I will take it away. And then, Doc, I have a question. In my work history, I actually describe what I do here in the clinic, and I want to know if it is okay or if I can take something away. What do you think about that?
So first of all, what type of clinic do you go to? Is that a clinic what is like primary care where you see everyone, like that means pediatrics?
Yes,
and
except pediatrics, all I see adults. Yeah.
So I would just say it's an adult clinic. I'm a primary care provider. I would say first encounter provider. And I will take everything off after that. You don't need to take diagnose and treat patients with chronic condition because it's a given.
Okay.
You don't have to tell the medical history because you're going to do that. And you don't have to provide emergent medical care because you do that because that's a primary care clinic.
Okay, good. About my experience at the soccer league, I have to put all the places I work in, or it's not necessary?
So I would just describe what's your role. Are you the medical doctor? For example, what happens is there's a head trauma. Are you the person who's going to be in charge of the head trauma or the fractures and stuff? Yeah,
exactly.
So I would just say that are you the team's doctor?
Okay, perfect.
Or you are the league doctor. So what's your role there?
Okay, well.
So I would just describe that. And then I would say for how long you've been doing this, and then maybe that will be build up a story. Maybe you can do what's the name, like sports medicine in the future, part of internal medicine, and maybe that will be a really good start for you. So you can say I will put it all the way to the end. You can say I play semi-professional soccer, and because I am a physician, I became the physician of a team. So that would be a really cool story, but not like that.
Nice. Okay, perfect. That's really good. Well, I then put my experience in the university. I have a different organization from Adriana. For example, I then describe, can you go down, Adriana? Can you? Yes. I did some, like I was saying, an immunology teacher. I did some anatomy to work. I worked for the Dermatology Society here in Mendoza, that it was a volunteer from the government, because what they do all the years is to set a place where you can collect people, call people, and they can do it freely, where we always analyze if they have some lesions in the skin, and maybe we can prevent important diseases, like, for example, melanoma. That's why the government here in Mendoza promotes this campaign. And I apply for this work because I think it's not a work, it's volunteer, because I didn't receive any pay, but I think it is important for the community.
So Andres, I would spend a little more time in saying exactly describing those things, because they're important. You're doing primary care, but on top of that, you're doing primary prevention of skin cancer. So, I would just be a little bit more descriptive. It's just saying dates about what are you doing with your dates. And again, Same as Adriana, you want to say what's your teaching experience. You can say you were a TA in immunology, a TA in anatomy, and you can describe for example, you were the course preparation, or I don't know, call it dissection. I don't know how you call that, but just look for the right word for that and describe exactly what is your role and how do you get to that role. Say top 5 GPAs will get that role. So again, I would just be a little bit more descriptive about what are you doing in those roles and how that important in your CV, why they are important in your CV.
Excellent. Okay. And in the final section, I put all my certifications that I remember. I had just passed my last course because I know that to do a residency there in the US, you have to have some investigation work, and that's why I applied for a course in Johns Hopkins University. This is a course that is online, and well, it was the introduction to systematic review and meta-analysis. I'm planning to take more courses to have more knowledge about this field, because then I want, if possible, I go to the US, like I say in my resume, I don't know, working for some laboratory, or maybe with some doctor and a tutor, and how do you say it, to publish.
So I would just use exactly. Did you get any certificate saying,
Yes,
Andres passed, he is certificate in systematic review. So that's actually important. So I would just list it like that, and I would just say the date and actually what entails. I would say 1 year of online course of doing, for example, systematic review meta-analysis.
Perfect. Okay.
As far as emergency and urgent care, is that like ACLS and all that stuff? That's what you're meaning about the emergency and urgency care hospital. So I would just list it at ACLS and all that stuff. The rest of the stuff I don't think there is necessary about. I don't know what your certification, acute abdominal pain or sepsis, or decompensated cirrhosis, or disorder of consciousness. Unless you did something really important there, I would just take them off of your certifications, because they're just courses that you took at some point in your life.
Okay, perfect. And doctor, I have a question. Now I'm actually preparing for the ACLS and ATLS for trauma and I want to know if they are really important for application there in the US, maybe in emergency or in internal medicine.
So they're not, when you apply to residency and you get matched to a residency, that will make you take them again here. So they're important. Yes, it's important to know exactly how to take care of an emergency, but it's not important to list it. So I would just say, if you have an ACLS credential, I would say pass ACLS certification. They're 2 years usually. So I would say, November 2016 to November 2018. That's what I would just use in there.
Perfect. Okay, I appreciate it. I think, and something that I didn't mention is that in 2019, I did a medical research in my med school, but it was about genetics. I did it because I don't want to be a genetician, but I want to learn more about PCR techniques. And the lab give me a place to work, and then we present some case reports about people that have Prader-Willi and Angelman syndrome here in my city, and we present it in Congress here in Mendoza.
Was there then Andres, was there an abstract? Was there a poster? Was there an oral presentation?
Yes, it was a poster. It was a poster,
and you were the first author, the second author?
The second author, yeah.
So that's important to know. So I would just say in publications, I would say you had a abstract presented in the National Meeting of Genetics.
Perfect.
And I would just basically, you have to list the reference. So I would put your authors, I would put actually the title, and I will put exactly, was it presented, I would say Mendoza, Argentina in 2021, and I will list that. That's actually the important thing. So that's exactly the things that you want to post in your CV, which I don't see.
Exactly. And it's necessary to put the poster or no?
No, but I was just, you will have to list the, basically the same as you will list any publications when you look at someone in PubMed, I will use the same thing in your poster.
Okay, perfect.
So that's the more important than all the things that you have. So again, remember, same as Adrian Andres, you're telling me a story. You want to be either a surgeon or an internal medicine doctor. You've done work in the past is taking you to that place. So what are you doing in between? So for example, I don't know, maybe the story, you want to be a sports medicine doctor. You want to be the team physicians, right? So,
Right.
I've been the team's doctor for 3 years. I would love to get internal medicine or surgery to be a sports medicine physician because I know my passion is sports and I want to use medicine with sports. So again, this is
Nice.
how you build up a story.
Perfect, Doc. And what about languages? Is okay to put them in the CV? Because
Yes, I would just use, this C1, B2, this is actually a new classification. I don't know. In my times, it would be proficient and efficient, and they will say conversational or even kind of medical. So
okay,
unless you're really fully conversational with a language, I will list it. Otherwise, I will not list it. So
okay,
if your English is, I don't know what C2E is, but if you're conversion, we're doing enough. You say English, Spanish, and Italian, then I will use them. So yes.
okay, perfect. Yes, I understand that. Perfect.
Yeah.
And
again,
Doc,
there's some other things about, like, for example, social media. I am not really kind of like something in kind of our applications. You really do not want to make sure people look at your social media. It could be a good thing, could be a bad thing. So I will not list anything about your social media because again, you never know what the people are going to find. So I would just say, hey, I am Andres. I will take all that away, completely away.
Okay.
And I'm not saying that you're doing anything bad, but you don't want to just, there's sometimes pictures that we don't want to be in them, and then they came up. So again, just to be curious about those.
Okay, perfectly. I'll take it away. And Doc, it's okay to put the certificates in the last section, or I just have to take it
If
away?
it's a certificate, it gives you for example, ACLS will give you a card, right? And I would say certifications, I would say ACLS certified from this year to this year. Unless there is a certification, there's no point of you listing them.
Okay, perfect. Yes.
Thank you, Andres. Do you have any more questions for Dr. Bonder?
No, Doc. Thank you, Kendia.
Okay, thank you, and congrats on your step 1 pass.
Thank you very much.
We do have a lot of questions for Dr. Bonder from our YouTube live chat. So, and the first question for Dr. Bonder is, if I rank at the top 50% of my class, how can I twist this in my favor?
You said top 5% or 50%?
50%.
50, 50, 5?
50, 50.
I would not use that because top 50 is really not a kind of a good thing to show. So again, remember that a few things, and I'm going to show you how, for example, like I'm going to give you a hint about what they're doing. In the big academic programs, they actually classify programs in 3 buckets. They do the bucket of what we call the Ivy League heavyweight medical schools in the US, you name it, Harvard, Yale, Stanford, all those medical schools. And then the next bucket is kind of the good medical schools, but they're not as prestigious. I would just say in Boston University, in Chicago, you have Rush, which are great medical schools, but not kind of the top ones. And then the third bucket is everything else. And basically foreign medical graduates get dumped into that bucket. And then from that bucket, from the third bucket is you need to show me that you are a rising star. And how are you going to do it? If you tell me 50%, 50% is not a rising star. You need to show that you're going to be in the top 5%, top 1%. And the story needs to be kind of consistent. I was number 1 in my class. I've done all this amount of research. I've done this number of voluntary work. And this translated into me coming into the US and doing research, doing an MPH. So again, the top 50 is not a way, there's no way to kind of flip or kind of just change the 50 to a story that is good. So I would just take it off from your CV if it's possible.
Thank you. The next question is, what volunteer work can we add?
That's a great question. I would say volunteer work does not translate in anything important from residency. And let me tell you why. So things that we looked again. So we want to make sure that you have letters of recommendation for the US. Voluntary work, unless we'll give you a letter, I don't think there is a lot of things, there's a lot of kind of time. It's a lot of time. It's a lot of wasted time. And the other thing is research. So if the voluntary work is in research and you actually become productive in research, then yes, it's a good volunteer work. But otherwise, if you tell me you're coming here to shadow me, that's not really going to do anything good for anyone.
Okay, next question is, can we keep mentioning the year we started med school?
That's a tough one. The answer is yes. So let me tell you why. There is different residencies or programs that will not take graduates that are being beyond 3 to 5 years graduating from the medical school. So that would suggest some people that if you do, then you have to justify what were you doing in those timelines. So people would say, I did a master's degree, or I was doing an MBA or something else. But if not, there's some programs that will exclude you based on the time that you spend out of medical school. So yes, it is important to try to apply as soon as possible, because then you will be excluded from a really decent amount of programs.
Okay, the next question would be, what would be the right way to add, perhaps, say, I have received honors in my clinicals and have received an award as best intern?
Exactly like that. So as a best award, you're number one. So I would say, top 1% in the internship class. I got a clinical award for being, I don't know, in top 1% in my clinic rotations in internal medicine. So that's how I would actually frame it to be useful in your CV.
Okay, perfect. So the next question is, I have worked as a medical officer after graduation. I would like to know what would be the right term to use.
What is a medical officer? I don't get it. So I don't know what's a medical officer. So is that someone who basically looks at charts? I don't know what a medical officer means in different countries. So I'll have to know exactly what that job details.
Okay, next is, how can I show my volunteer work?
It depends if it's meaningful. I would just going to take, for example, Andres, like, CV is, maybe his volunteer work is spending time with the soccer team on the weekends. And again, if the story is that Andres eventually wants to be a sports medicine doctor, that would be something useful for his CV. So again, it depends on what the story is and what are you trying to actually go for the future.
Thank you. And next question is, should we also mention high school graduation year or the year we received diploma?
Great question. I would say I most likely not. I don't think anyone counts high school's diplomas or degrees unless there was something really special about it. So no, the answer is no.
Shalmali asked the question, what should be added in top 10 experiences for this year's CV? Should we include significant work in our home country, or USCEs should be given preference?
I would say there's no preference of either your country or the US, as long as it's impactful and actually, again, goes and matches with your story.
Okay, so Carlos Romero asked, I am currently looking for research position, but I don't have research experience. I do have research courses. How should I enlist it or put it in or should I put the research courses in my CV?
I would. And again, most of the people who are looking for a research position never had any research experience. So there is nothing wrong with that. So, the research courses or certifications really don't matter that much. I think the CV is the important one. And again, there's different programs, there's different requirements. So I would just basically tell you that there's not enough people with research experience out there who wants to do research, unless you are a full PhD or a master's in public health or in statistics. So again, all of you guys are welcome to kind of try to get and recruit and be in a research position.
Okay, next question is, if I'm applying for research positions and I don't have any publications, but I have attended various workshops and courses, how should I mention it in the CV?
that's the useful part, you know. I would say that you are efficient with, I don't know, I'm making this up, Stata, which is a program that deals with stats, or R, which is a program that deals with stats, because that's a person that would like to get into my lab because I know they will be able to help me. So the publications will come once you are able to join someone who will help you to publish.
Next question. Is there a specific format that we should present our CVs?
The answer is no. I think you've seen two different types of formats. I like both of them. You know, they're different styles. So, for example, when you're applying to residency, when you look at the ARAS format, it's very standard. And again, they will ask you specific things. But again, when you're sending your CV, I just want to make sure there is something presentable and it's actually, you know, you're not making anything up, and then you are basically just showing that you are a person that is able to do the job you're applying to.
This is a good question here from Ashmita. If I'm not first or second author of research publication I have, how can I present it impressively?
I will still list it. A publication is a publication. You know, for people who've never published, publishing in these days is really, really hard. And you want to show that you've done some work. Don't take that really away from you. So if you're third or fourth author, I really don't know the context of that authorship. But, you know, there's a lot of multi-center trials that, you know, I'm the 26th author, but it's actually an important clinical trial. So I would say list everything that you have in research because it's important to show people that you're able to do research.
Okay. This is a question about the gap, specifically if there is a break in the resume due to maybe looking after my child or maybe some illness, how does one put that in?
I will list it exactly as you're saying. So it depends on the timeline. But you know, if you're taking care of someone who is ill, or you're taking care of your you know, your new mother or a new dad, I would just list that. You know, we shouldn't be punished for being parents or being regular persons. So I would just make sure that you document that and you say, hey, listen, I took a year off because I wanted to take care of my newborn. So I just will describe it like that, and it shouldn't be a punishment.
They have a question about putting the pictures on the CV. I am applying for a research position as well. Is it okay? Is it bad to put pictures on our CVs?
No, I think there are different styles of CVs. Again, you saw two different styles. For example, Adriana did not have a picture. Andres had a picture. I really don't mind. It's just a matter of, again, you know, what do you want to do with your, you know, what do you want to do with your CV? But again, the CV, the kind of the core of the CV is kind of what's in there. And the picture is really not showing anything. So again, I would not put a lot of things in the picture. I would just basically emphasize on the importance of having a really good CV.
The same person that asked about the gap asked another question, an important one. What does one need to make a strong resume or CV after a break?
It depends on the length of the break, but also it depends on what was the break for. So let's say I took a break to be, I don't know, did a master's degree in business, you know, then I would just list that. Let's say I took a break to take care of dying or sick parents, then I will list that. So I don't think that makes it either a stronger or weaker CV. It just, you know, you have to make sure you list the differences of the problems and I would say not the problems. I would just list the kind of the breaks or the time frame that you actually it's listed in your CV.
So how long should be the CV?
Great question. You know, I would say as long as you need to, you know, there is no really guidelines to say a CV should be 5, 6, 7, 8, 9, 10 pages. As long as you're actually, if you have a good CV, and again, that doesn't mean that like a 20 pages CV is the right CV. As you can see, CVs can be a lot of full of crap too. So just as long as you list the right things, you don't have any kind of any really length on that.
We have a question from Andreina. I am a research assistant in my home country and most of my publications are published in Hispanic journals. Would that be valuable in my CV?
Yes, they're PubMedable, yes. So as long as you can look for them, the answer is yes to that.
Perfect. A few more questions. This is a question from Mira. I have been scared of applying for research positions because I don't have any publications yet, but I do know how to conduct meta-analysis and other research too. So should she apply for research positions?
Yes, and again, I will list that as your strengths. You are a person who can do this type of analysis. And, once I would just look for a researcher who basically his main research interest is doing this type of studies.
A lot of research questions. How to mention the unpublished papers or studies that are undergoing.
Really good question. I would say, but really submit it to the journal. You're still waiting to hear from them. And I would just basically list it to submit it to this journal, and then that's it. If it's submitted and accepted, I would say submitted and accepted for publication. And if just recently submitted, I would say just recently submitted to this journal. I want to just kind of send the message that you should not say anything that is not accurate in your CV, because that can go really backfire to any of you. So make sure, remember, all those things are searchable or researchable. So if you're looking and you're submitting something, you can always find out that that's true or not true. So again, make sure that what you are saying in your CV is accurate.
I have two more questions about all grads. I have one that says, I am an all grad from 2016. Is that a red flag? And the other question is changing med schools a red flag?
The answer is no. So all grads, so again, there is different types of residencies that will accept all grads. So again, I want to make sure that I kind of like, I'm serious, I'm actually touching the right point about it. There are certain residencies that will not interview candidates who actually are at least 3 to 5 more years out of med school. All right, that doesn't mean that you are a bad physician. That doesn't mean your scores were wrong or your CV is not good enough. It's not the way how they screen for their applications. So there's no way to get into those places and those places, and it's very strict. And I've had all people who graduated a long time ago and they spent in their home countries doing all the degrees. For example, I have a couple of friends who actually were surgeons, orthopedic surgeons, and came to the US starting all over, and they'd have to apply to internal medicine or something else. So again, it depends on the story. But I just want to point out that there is no bad reputation of you being an old grad. It's just basically you are limiting yourself to certain applications, certain programs, because of the programs who are taking those people.
So one last question. It's from Sakar. He says, after completion of medical school, I was given an opportunity to work as a chief of community hospital serving the underserved, which led me to have an increased gap in year of graduation. Will that help me in my CV, that work?
Is it only 1 year? I would say that will help you. And again, I will use that in your advantage. You were a person who were assigned some type of leadership position in a community hospital, and that will, I will just state that and use that in your advantage. Maybe you're the person you want to do, I don't know, community primary care or underserved patient treatment. So I will use it, depends on what those person wants to do, but that way 1 year gap is not going to be a big difference in this application.
Okay, they send me 2 more questions and our last 2 questions. Okay, is there a limit on how far back we should go back in terms of our CV?
The answer is no. As long as it's accurate and again, builds up your story to be a good applicant, it doesn't matter.
Okay, and the last one, does poster presentations have to be in the US or is it okay if we do it in our home country?
Again, you list all posters, all research are a lot of work. So I don't want to make sure that you take that into consideration. You know, any research is research, so please use it in your advantage to be part of your application, as long as it's something is accurate and it's true.
Perfect. Thank you so much, Dr. Bonder, for taking the time to help us and give us such great tips, such great insight. We really appreciate it. Thank you from Project IMG and TICMD, the International Conference of Medical Doctors. We really appreciate your time and all of the information. Thank you, everyone who joined us today on our live. Stay tuned for our next conferences and enjoy the rest of your day. Thank you. Bye.
Okay, Leah, have a good day.
Thank you.
Thank you very much.
Okay.